see the brief presentation of the platform by the Mediterranean Institute of Gender Studies, facilitated by Dr. Christina Kaili. Then we will have the privilege to hear our speakers, Vincent Briard, a Senior Gender-Based Violence Officer at UNHCR Regional Bureau for Europe, and Hafida Bachir, a Gender Advisor on the Cabinet de la Secrétaire d'État, on a fireside chat on a topic, best practices in engaging professionals to end FGM in Europe. So it's an honor to be able to present you in the platform and to hear from our keynote speakers on best practices. So thank you everyone for joining us. And before moving into our next part, let us show you already a bit of the platform in form of this video teaser. Thank you.
Female genital mutilation, or FGM, is a violation of human rights, affecting millions of women and girls worldwide and hundreds of thousands in Europe. Are you a doctor, social worker, teacher, or another professional working with FGM-affected individuals, or those at risk? Do you feel unsure how to best support them? Would you like to enhance your skills and capacity to prevent FGM? The End FGM E-Campus is a free, user-friendly online platform providing high-quality training tailored to the needs of professionals like you. Access up-to-date knowledge from field experts, practical guidelines, and context-specific information for European countries in 5 languages: Italian, English, French, Greek, and Portuguese. Learn about FGM, its consequences, legal aspects, and how to provide gender-sensitive, culturally appropriate support through 5 comprehensive modules. 1. Introduction to FGM. 2. Health, managing the consequences of FGM. 3. Protection, legal and policy measures against FGM. 4. Prevention, raising awareness on FGM through education. 5. Community engagement, working with FGM-affected communities. Join a global network dedicated to ending FGM. Register for free, complete the training, and earn your accredited certificate. Be part of the solution. Visit www.endfgm-ecampus.eu to learn more and get started.
Now, without further ado, I would like to welcome and give the floor to Dr. Christina Kaili, who is Senior Researcher and Project Manager in the Mediterranean Institute of Gender Studies, MIX. Christina, over to you.
Good afternoon, everyone, and thank you very much for joining us today in this important webinar, and a warm welcome from the consortium of the E-Campus and the Mediterranean Institute of Gender Studies to our esteemed keynote speakers and international organizations, professionals, NGOs, and university students. A warm welcome. I will start my presentation if you can share the screen, our colleagues from the network. I will start my presentation by pointing out a lot of the aspects that were beautifully presented in the video that we just watched. To say that the End FGM E-Campus is a free online platform providing high-quality, accessible training for professionals supporting FGM-affected communities. Can you see my presentation? Okay, shall I wait for a second?
Yes, please, one moment.
Okay.
We are going to put the presentation in one moment.
Sure, no stress.
Yes, I think we can continue. Thank you, Christina, for waiting. And thank
Wonderful,
everyone
thank
for
you.
your
You will be
patience.
passing on the slides, right?
Yes.
Okay, wonderful. So as you have wonderfully seen from the video that the End FGM network kindly produced with the program, this event is actually an important event for us as a consortium of partners and the members of the End FGM network. First of all, to raise awareness about this initiative and this e-learning tool, but at the same time to encourage the endorsement of international organizations and professional organizations that will amplify its impact, helping professionals from different fields access essential tools like this one and contribute to eliminate FGM in Europe. Next slide, please. So why this initiative, which goes about a decade ago, a decade for 10 years now, this initiative that we are promoting with our partners, because over 600,000 survivors of FGM in Europe and 190,000 girls and women remain at risk. And despite progress in policies and legal frameworks, gaps in knowledge and training hinder effective support for survivors. So our aim is to tackle key knowledge gaps. Professionals from our previous experience, but also from our current work, often lack gender-sensitive and culturally appropriate training, essential for delivering effective care and support. Next slide, please. Therefore, our effort is, first of all, design this e-learning platform by experts for experts, developed by leading organizations in the field in Cyprus, Italy, Portugal, Belgium, and the European Union. Our target audience, which I will also present later on, are healthcare providers, asylum support staff, educators, youth workers, media professionals, justice professionals, lawyers, policymakers, and civil society organizations, but also university students in this field. Next slide, please. We have seen also from our previous experiences in piloting this kind of initiatives that apart from the expertise that is needed to provide this information to professionals, and it's information that often is not part of their formal curriculum in universities, we have also seen that these kind of tools, especially in the digital era and especially in the post-pandemic environment, are very useful, interdisciplinary, multilingual learning tool for health professionals, and not only, but also for a diverse set of professionals. So, next slide, please. Our partners, and I will delve into our complementary projects in a bit. Next slide, please. So the aim of this online platform for e-learning is to raise awareness and provide expert knowledge on the effects of FGM on the physical, psychological, sexual, and reproductive health of women and girls, develop skills to improve the satisfaction of the health needs of women and girls living with the consequences of FGM, and not only in the health services environment, but also in a diverse settings like police, asylum context, protection context, and so on. And also to help the professionals develop the communication skills that will allow them to provide better care and support and protection. Also, at the same time, this initiative comes in a timely timely way because of this all these international human rights standards in place, especially in the European Union, but beyond, and also corresponds to the need of the Agenda 2030 and also many other human rights instruments internationally and in the European Union, and also to prevent FGM. Next slide. The target groups, as I said before. Next slide. Now, at the moment, we have 21 endorsers, and a big shout out to UNHCR for being our champion since the inception of this idea, peer reviewing our material and all the support they provided. But at the same time, at the moment, we are in an early stage, but it was very well received by a number of endorsers, including professional associations, universities from different countries, also international organizations and national commissioners. I will talk more about endorsements in a bit. Next slide. Now, what are the benefits of endorsing an e-learning portal, a portal focusing on FGM? First of all, it's important to be a leader, to position your organization as a driving force in achieving global gender equality and in eliminating FGM. Also, it's important to support social change, help create inclusive, sensitive support services for survivors and for communities at risk. Amplify the reach of this cause. Your endorsement will help professionals across Europe and internationally, potentially, to access vital tools and strengthen their capacity to act. And also, to enrich partnerships, also the scalability of the project. We hope that in the future we can provide more modules in more languages, but also to ensure that these kind of tools are accessible to everyone and all the relevant professionals. At the same time, on how to support the platform, official endorsement, we could feature your logo and organization as an official supporter on their website. Also disseminate the platform within your networks among colleagues, staff, and students. And of course, we very much welcome financial support for the sustainability of the project and the portal. We know that this kind of digital tools require a certain effort, financial, technological, maintenance, etc. And also, you can advertise the platform on your website, communication channels, subscribe to the mailing list to stay engaged and with updates and opportunities on new modules or new languages. Next slide, please. So now let's quickly navigate the content of the portal. There is, for the first time, to enter, for those who are interested for the online course, for which I will speak in a bit, there is a very easy sign up button with a straightforward form that you can create your credentials. And after the first time, and after agreeing to the terms and conditions, you will receive your credentials and you will be able to log in at your own pace, at your own time, the e-learning course. Next slide, please. Now, the access to the portal is at no cost, at your own time, especially those of you who are interested to take the course. As indicated in the video that we screened, we have 5 modules. We require the registration so that you can enter the course section, but we also offer country information pages for at least 4 countries that are part of the project, but at the same time with our sister project, the End FGM Interactive Map, you can also visit more national information on national policies, data, available services. This section is particularly useful to officers in the asylum sector and other sectors that require national and specific country-specific information. For this part, no registration is required. Next slide. So the portal at the portal, of course, the country-specific information will be made available to you very soon in English and the national languages. Next slide, please. The first module is a foundational module that every learner has to complete before moving on to the specialized learning modules on health, protection, prevention, and community engagement. And after you complete, next slide, please. It's offered in 5 languages, as we said before. Next slide. Also, we've offered a resources section that this is particularly useful to endorsers, where you can find the glossary and also 2 kinds of leaflets that you can promote either to potential users of the platform, the professionals that are part of your association, or also leaflets that are particularly useful to possible endorsers. They are all available on the main page of the portal. Next slide, please. This is one example of how Module 1 looks, the key learning objectives and the intro video signifying the learning objectives of the project, of the module. Next. And here to briefly explain, each module is divided in learning units. And after you complete each unit, each unit, of course, has a self-assessment exercise, which is interactive and very short. And after you complete all the specialized units of each module, there is a final quiz, which you can try for several times. The passing rate is 8 correct answers out of the 10 questions. Then we ask you to provide some feedback, and then you can download your certificate for each one of the modules. Thank you very much. I'm here for any questions or clarifications you may need. Thank you very much.
Thank you very much, Dr. Kaili. Now I'd like to give the floor for the fireside chat to Vincent Briard and Hafida Bachir, our speakers, that is going to be moderated by Jenny Dane, our Policy and Advocacy Coordinator. Jenny, Vincent, Hafida, the floor is yours.
Hello. Thank you, Caral. Thank you, everyone, for the presentations and to everyone who is here with us today. I am very excited to be moderating the conversation with Vincent and Hafida. I just wanted, to introduce myself, saying that I am indeed the Policy and Advocacy Coordinator at the End FGM European Network. So we are a member of this project. We are very excited that we can finally launch it. Make it also known to institutional actors for endorsement and continuation of the positive effects that we hope the platform will have. I just want to mention in terms of the structure of the next session, it will last approximately 20 minutes. To be fair, we started a bit late. Sorry about that. So I hope we will not be too much out of time, but I will just ask Vincent and Hafida a couple of questions alternated. So please, both of you, if you can take not more than 5 minutes to address both questions, each question, that would be great. And for the audience, I just want to mention that I will be addressing Hafida in French. So there should be one of the interpreters in the main room now. And I will ask Hafida to please wait while she is being translated consecutively into English. Donc, can you confirm that the interpreter is here? Sorry, I don't see everybody. Yeah?
Yes.
Ok, wonderful. Hi. Donc, je disais à Hafida que déjà, bonjour.
So I'll say Hafida, hi.
Ah, wait, sorry. I think we hear the interpretation in the main room. Is that?
Exactly.
Yeah, sorry. Zoom technical issues. No one likes them. Okay. Is it working now? I don't hear the interpretation anymore. Je n'entends pas. Du coup, j'espère que c'est bon. OK. Voilà, je disais bonjour.
Sorry,
Hafida.
no, there's an issue, a technical issue.
OK.
Sorry, I can't interpret. I haven't got any canal to interpret.
Okay. I hope Carol and Ludovica can support you with that.
Yes, please, Jenny, you can continue. The interpretation is going to be through the English channel.
Wonderful. Okay. Voilà, je recommence. Bonjour encore une fois, Hafida, merci beaucoup d'être avec nous aujourd'hui. Alors, je disais justement que je vais vous adresser en français et déjà, voilà, c'est très important pour nous en tant que réseau européen d'avoir vraiment la participation et le soutien d'un représentant du gouvernement belge dans un événement comme ça, puisqu'on veut justement mettre... sorry. I see I have to... OK. Puisqu'on veut justement mettre en avant la plateforme End FGM E-Campus et justement la présence de la Belgique, par exemple, est très intéressante, non seulement parce on a aussi un membre belge qui fait partie du projet, mais parce que déjà dans notre mapping en 2021, quand on avait publié pour la première fois la online map, d'ailleurs je pense une de mes collègues va la mettre dans la chat pour... qui ne la connaît pas, comme ça vous pouvez voilà, cliquer, mais ça fait aussi partie de la plateforme. Voilà, quand on a centralisé alors toutes les informations liées aux mesures contre les FGM les MGF qui sont en place dans différents pays européens, justement, on a aussi fait un effort de mapping et d'identification des bonnes pratiques dans ces pays-là et justement, il y en a qui sont en Belgique aussi de bonnes pratiques et qu'on essaye de promouvoir. Alors, c'est très bien, voilà, dans ces occasions-là, de pouvoir utiliser ces exemples positifs pour qu'on puisse en fait améliorer la mise en place de ces mesures qui sont visées à prévenir les MGF, mais la violence faite aux femmes en général, la violence de genre, et surtout pour pouvoir après, disons, donner l'exemple à d'autres pour qu'ils puissent suivre et s'inspirer, on va dire, de ces exemples positifs et de succès et les adapter à d'autres contextes. Du coup, voilà. Je souhaitais alors, pour aujourd'hui, m'adresser justement à vous, Hafida, pour vous demander d'abord en quoi pourrait-on, disons, s'inspirer de la Belgique ou apprendre de la Belgique quand il s'agit de mettre en œuvre ces politiques efficaces contre les violences, y compris justement les mutilations génitales féminines. Et juste un petit rappel, alors la traduction va être consécutive, du coup, s'il te plaît de ne pas faire des réponses, enfin de t'arrêter un moment pour que la traduction ait le temps de se faire doucement pour tout le monde. Voilà, merci, je te laisse la parole.
Ok, ben, merci beaucoup. Merci pour l'invitation et bonjour à toutes et à tous. Donc en fait, effectivement, donc je travaille plus précisément au niveau du cabinet de la secrétaire d'État à
Ao nível do
l'égalité.
Gabinete da Secretária de Estado. Perdão, aconteceu alguma coisa com a interpretação.
Sorry, there is again the interpretation in the main room.
Er is weer vertolking in de hoofdcabine.
Okay, seems that we had an item. Sorry for that. The interpretation is back. Could we restart, please?
Oui, on peut continuer. Oui, merci.
Ok. Donc je disais que je travaille au cabinet de la secrétaire d'État à l'égalité des genres qui a la responsabilité, donc on est en affaires courantes ici, donc bientôt on aura un nouveau gouvernement au niveau de la Belgique, donc moi je fais référence évidemment au travail qui a été réalisé durant la législature précédente. Et donc, dans les responsabilités de la secrétaire d'État, il y avait la coordination de la politique de lutte contre les violences basées sur le genre et en particulier du plan d'action national de lutte contre les violences avec l'ensemble des différents niveaux de pouvoir. Alors moi, j'avais envie de mettre en évidence peut-être des lignes de force en essayant d'illustrer par quelques... Je ne sais pas si on peut considérer ça comme bonne pratique, mais en tout cas, ça fait plaisir d'entendre ça. Mais voilà, ça fait souvent écho à la réalité belgo-belge. Et donc, s'il y a des éléments qui peuvent être transposés dans d'autres pays, voilà, je suis vraiment ravie. Alors, d'abord, la première ligne de force qu'on a eue, c'est de développer sur le plan structurel une coordination de nos politiques conformément à l'article 10 de la Convention d'Istanbul, parce qu'on était quand même fort interpellé sur le manque de coordination, manque de politique globale au niveau de la Belgique, étant donné qu'on est avec différents niveaux de pouvoir, avec des régions, avec des communautés, avec le fédéral, et donc on est un petit pays, mais avec très complexe, et il fallait avoir une politique coordonnée. Et donc, ça s'est fait à travers le plan d'action national de lutte contre les violences basées sur le genre, toujours en cours 21-25, comme point de référence de la politique coordonnée. Et l'attention a été portée dans ce cadre-là à adopter un cadre conceptuel de référence sur les violences basées sur le genre. Il était important, étant donné justement la diversité des actions, la diversité des manières d'approcher la question des violences, de pouvoir se donner un cadre conceptuel de référence qui a été partagé par l'ensemble des acteurs concernés. Ça va?
Excuse-moi, désolée de t'interrompre, c'est juste si je peux vous demander de parler un tout petit
Un
peu
peu
plus
plus bas.
doucement, voilà,
Ok.
juste pour la traduction, merci.
Ok. Et donc, quand je dis un cadre conceptuel de référence, c'est en lien avec ce que demande la Convention d'Istanbul, c'est-à-dire une définition commune, un ancrage des violences dans les rapports de domination, d'intégrer aussi le continuum des violences et la diversité des violences que rencontrent les femmes. Et donc, c'est ça, on s'est vraiment mis d'accord sur une manière de faire, mais aussi sur des méthodologies. On s'est donné des mécanismes de monitoring parce que, ben voilà, il suffit pas de mener des actions, il faut pouvoir les monitorer. On a aussi défini des lieux de gouvernance, des lieux de suivi avec les politiques et les administrations qui sont concernées par les politiques de lutte contre les violences aux différents niveaux. Et d'ailleurs, cette politique coordonnée a été saluée tout récemment par le comité des parties à la Convention d'Istanbul qui a salué ce travail de coordination à travers le plan d'action national. Donc ça, c'est première ligne de force, c'est une politique globale coordonnée dans laquelle les violences, les MGF se trouvent et donc pas quelque chose d'à côté, même si c'est super important d'avoir des politiques spécifiques par rapport au MGF et je vais revenir. Deuxième ligne de force qu'on a privilégiée, c'est la coopération avec la société civile. Alors, on sait très bien le rôle qu'ont joué les associations de femmes pour révéler les problèmes de violence et pour même mettre sur l'espace public la question des violences, le mécanisme des violences. Cette expertise, elle vient de là. Et les associations de la société civile et en particulier l'association de femmes attire aussi l'attention sur les difficultés et les besoins des femmes et surtout les femmes en situation de vulnérabilité. C'est ce que le GAMS a fait pour la Belgique. Alors, les associations de femmes sont devenues, dans le cadre de nos politiques, vraiment des interlocutrices de premier rang tout au long du processus d'élaboration, de mise en œuvre et bientôt d'évaluation des politiques que nous menons. Mais il fallait aller au-delà de cette reconnaissance, au-delà de cette consultation ponctuelle. Il fallait faire en sorte de reconnaître et de pérenniser le rôle de la société civile dans le processus des politiques de lutte contre les violences. Et c'est comme ça, moi je vous donne un exemple, mais il y en a d'autres. Et les régions ont aussi mis en place des mécanismes aussi de suivi. Mais en ce qui concerne le fédéral, on a mis en place en 2022 la plateforme nationale de la société civile chargée du suivi du plan d'action national. Et elle regroupe 16 associations qui sont représentatives de la diversité des publics, de la diversité des formes de violence, et le GAMS en fait partie. Troisième ligne de force, on a augmenté les budgets consacrés à la lutte contre les violences basées sur le genre. Je ne vais pas donner le montant parce qu'il peut paraître, voilà, on est un petit pays, mais il y a eu vraiment des montants qui ont été dégagés à tous les niveaux pour soutenir la politique de lutte contre les violences. Mais pour ce qui concerne le niveau fédéral, On a aussi renforcé les moyens de l'Institut pour l'égalité des femmes et des hommes qui est chargé du suivi, de coordonner le plan d'action national et du suivi des politiques de lutte contre les violences. Mais on a aussi dégagé des moyens pour réaliser des études, des campagnes et des autres projets portés par les pouvoirs publics. Quatrième ligne de force, on a aussi dégagé des moyens pour financer le fonctionnement et les projets de la société civile. À nouveau, ce sont des financements qui viennent de différents niveaux de pouvoir et c'est des financements, des subventions, des conventions pluriannuelles qui permettent, si je m'attarde un petit peu sur la question des MGF, à des associations comme le GAMS de mener des actions de sensibilisation, de formation, des professionnels, de prise en charge et des victimes. Et voilà, je ne vais pas m'étaler plus que ça, mais la cinquième ligne de force, on a aussi, c'est peut-être ça où je voudrais citer quelques bonnes pratiques en la matière, on a mené des politiques spécifiques par rapport à la lutte contre les MGF. On a d'abord pris des initiatives pour documenter les MGF. Alors, la Belgique, elle a une tradition de réaliser des études de prévalence des MGF. C'est super important parce que ça permet aussi d'avoir des éléments objectifs pour orienter les politiques publiques. Et durant cette législature qui se termine, on a réalisé la 4e étude de prévalence en collaboration avec les chercheuses du GAMS belge. Bon, je passe plein de bonnes pratiques, mais c'est pour essayer d'en varier les types. En termes de prise en charge des victimes, on a en Belgique, ça date d'il y a quelque temps, 2 centres de prise en charge multidisciplinaires des victimes de MGF. Donc, on en a un à Bruxelles et on a un en Flandre. Les 2 centres hospitaliers accompagnent de manière holistique les femmes et les filles en subi une mutilation génitale féminine en termes de soins médicaux, chirurgicaux, sexologiques, psychologiques. Et ces soins sont entièrement remboursés par la mutuelle, y compris la reconstruction du clitoris.
En effet, oui, merci. Désolée, je sais que la liste est probablement plus longue. Je me permets de t'arrêter juste pour ça parce que justement, l'approche multidisciplinaire et holistique, c'est effectivement une des approches les plus importantes pour nous aussi. Et ça a démontré que c'est une façon effectivement plus durable de se prendre à l'élimination des MGF. Je vais juste passer pour une autre question pour l'instant à Vincent et après je reviendrai pour la continuation de notre conversation. Mais merci pour l'instant. So I'm gonna switch to English. So I'm just going to address Vincent. Hi, Vincent, thank you for being here again. We just wanted to say that indeed with the UNHCR, we first of all are grateful, as Christina was saying, for the support showed to the platform, but also there's been a lot of cooperation in the past with the network in terms of especially, developing common recommendations and looking and analyzing the nexus between the FGM practices, or at least the FGM support and prevention measures and the asylum procedures, etc. And also the data that UNHCR has collected in the past has always been very helpful for our work. So today I just would like to hear from you from the UNHCR perspective and, as a practitioner where you have worked in different contexts and countries. You have had the opportunity for sure, as we were saying the other day when we spoke, to witness many challenges, but hopefully also to see what can and cannot work. So to see and maybe have some examples of lessons learned. And to see what actually can help us make progress towards the elimination of GBV and FGM in particular. So just today, I think it would be relevant in the context of this platform and what best practices we can highlight, to mention for you, in your experience, what are the most common challenges that you have encountered, and how can a platform like the E-Campus and End FGM E-Campus, be useful to overcome those challenges. So if you think that this type of initiatives are in line with the strategies that work on the ground. So yeah, I just let you the floor. Thank you so much.
Thank you. Hi, everybody. Thanks for the invite. Truly honored to be here. Thanks to the End FGM Europe network, the participants. In 5 minutes, it will be a challenge. So I will try to go to the point. Several angles. But first, we not only appreciate your work and admire, but we endorse and support because we need to be a bit subtle sometimes in the way we work, and we are not. I've been working for 30 years as a volunteer and for 20 years as a UNHCR practitioner, and it's one of the most difficult topics. So we have to be modest, and this platform, this launching is important because we firmly believe that for such a complex, multidimensional, interdisciplinary challenge in Europe, we need to exchange good practices, but to tell the truth to ourselves. And maybe to respond to your third question, reach a critical mass, I would say, of sympathizers, activists, but lobbyists, I would say, human rights influencers, but with the appropriate terms and discernment. So it's important to increase our common intelligence. As Socrates, some Greek are here, Kalimera, we need to know that we don't know nothing. We know a lot, but it requires a lot of creativity, a lot of in-depth analysis of what has been working in the UK with which diaspora, etc. I will get back to that quickly, but the level of knowledge, skills, attitude required when we tackle not only with vis-à-vis asylum regime to support asylum seekers, women and girls especially, but also in terms of community mobilization, we need to know what we are talking about and to avoid the dilemma between, naming and stigmatizing. So that's, to me, the key of these platforms. Raise awareness, dissipate some myths, some taboos within ourselves. So it's about knowledge, skills, etc., but also imaginaries, representation, how we perceive the topic and how communities perceive. And this dialogue is complex. There are a lot of barriers. So this platform has a unique role, I would say, to play in Europe. So terms name clearly the phenomenon is important in our work and in the way we disseminate information and knowledge without fueling a certain rhetoric in Europe. It's important, without stigmatizing, but that's tricky. So for a UN agency, it's part of what we call harmful traditional practice. So it's an extremely serious violation of human rights. It's persecution vis-à-vis 51 Convention, so that's very serious harm. It's an extreme form of TPV. It has extreme physical, you said in the introduction, physical, psychological harm, obviously. So it's a violation of girls, women, fundamental human rights to health, to sexuality, sexual reproductive health, to security, to dignity. And we all want to eradicate and end all forms of FGM. And it's a global phenomenon. And you mentioned the name. So we condemn as a UN agency strongly all forms of FGM. But the way we work, this cannot be just based on this strong advocacy that we need to have. It needs to, because there's a bigger challenge, it's difficult to break the taboos of why is it so pervasive, why is it so difficult, despite it being a clear risk for girls and women with
le risque
it's difficult
ces
to
violences représentent.
Name and translate.
Sorry, translators.
In the forum room.
Pour le monde.
Interpretation failed again.
Vous êtes tous dans le même canal.
Yes.
Please return to your individual challenge.
I'm sorry for that. Interpretation failed again.
It's part of the Zoom monopoly. We have to have this conversation another time. But basically, we know FGM has no health benefits, psychological
Nous
impact.
savons qu'il y a des
We know some things, but
problèmes pour la santé, psychologiques, mais c'est la manière dont on fait passer le message et qu'on convainc.
Interpreters are in the main room. Sorry.
Yes, please. All interpreters are in the main room, please.
Sarah, let us know when it's...
Yes, I will let you know. We are managing this.
Another aspect, optimizing the time, is, of course, for UN Refugee Agency, the persecution. Any woman and girl who fear persecution on the grounds of FGM and cutting have the rights to refugee status in line with international European human rights law, refugee law, 51 Convention, and so on. So government should also, and we have to use those platforms to continue the advocacy for that. They should honor their regional international obligations under those laws to grant asylum and refugee status to girls and women at risk, irrespective of the legal status in their home countries. That's very important. Border force agencies, asylum practitioners in the public services, in institutions of Europe, immigration officers, they need to be trained and better trained. And this could really work in this sense to disseminate in a targeted manner the way you unblocked
Vincent, désolé.
the targets.
Je voulais juste vérifier que tout le monde puisse t'écouter dans les différentes langues. So,
Okay.
is it working now?
Yes, it should be working.
Okay, great. Thank you so much. Pardon.
So all those targets, no problem. Les plaisirs du direct. The way those training should put the focus and the emphasis on age, gender, diversity consideration, understanding also for asylum practitioners the effects of trauma and violence on the way they tell their story. All this has serious psychological and legal implication in the non-recognition of those stories. So again, naming and labeling is extremely important. And the Council of Europe, legally, member states should ratify, fully implement the Istanbul Convention, and then reinforce, bolster all the mechanisms for prevention and response. So having said that, do I have 2 minutes still? I would like to add just a few things, yes. Having said that, we need to name one challenge of many in years of experience is that many affected girls and women are not necessarily comfortable with the term female genital mutilation. It's just an example among many. I prepare others for another time, maybe. It can re-traumatize, stigmatize. So we have to reconcile both dynamics if we want to have an impact. When working with survivors, we have to talk to them about which terminologies they prefer. So, for instance, when I was in Dadaab for 2 years, we had 423,000 refugees at the border Kenya-Somalie, and we would say gudnin in Somali, and c'est l'excision en français, excision in French. So when you have 98% FGM rate, this is not a detail. We have to have a lot of intercultural skills used much better. Maybe we will discuss this later on. The challenge and the good practices exist in overcoming those intercultural barriers, and the immense social pressure to conform is something that must be explained in Europe. The families may also fear social exclusion or stigma if they do not have their daughters undergo FGM. All this, the links between religion, because no religion is associated with religious belief who are not in the religion text. All those are challenges and opportunities to engage those religious actors, even in Europe. The promotion of cultural identity and tradition challenge, the rite de passage in Europe, it's important because we don't have rituals anymore. So from girl to woman, all those conversations are just token. That's a personal comment in broad terms among the human rights community still. And we need to get into the aesthetics beliefs, the different myths, and the patriarchy control that entails that. And all this is about restricting the autonomy of women. So it's about gender, and it's not acceptable, and it's illegal in Europe. So all this tension is full of challenge opportunities, and we will be happy to share good practices in the platform, because we don't have time, of course, to list them. I will leave it there.
Thank you. Yeah, thank you so much. And indeed, you touched upon very relevant points, which are also included in that was my time, included in the platform itself. And yeah, also about the aspect of discrimination. My screen is religious discrimination. We are actually working right now on indeed on a paper that is analyzing this link and how religious discrimination, or just the false nexus that there is between FGM and prescription at the religious level needs to be debunked. So there's still a lot of work to do there with an intersectional approach that we are taking, and that hopefully the platform will also help to disseminate. So let me get back to French, to Hafida. Désolée, on n'a vraiment pas beaucoup de temps, du coup, si on peut être le plus synthétique possible, comme ça on peut laisser quelques minutes aussi aux questions du public, qui est la partie plus intéressante, je pense. Je voulais juste demander, Hafida, selon du coup l'expérience dans ton rôle, quel est l'intérêt, on va dire, de continuer à soutenir de projets comme E-Campus et en quoi cela c'est aussi intéressant au niveau de politique publique. Du coup, dans ce sens-là, forcément, il y a un focus pas que dans la Belgique, mais aussi dans l'intention d'avoir une valeur ajoutée au niveau européen. C'est ça, en tout cas, que nous, on voudrait atteindre. Alors, voilà, je souhaiterais entendre ce que tu en penses.
Oui, peut-être en se basant sur l'expérience qu'on a eue et ma profonde aussi conviction pour avoir travaillé pendant 30 ans dans la société civile. Pour moi, c'est super important de pouvoir soutenir ce type d'initiative parce qu'il repose sur l'expertise de terrain des associations qui connaissent le public, qui connaissent le fonctionnement institutionnel, qui connaissent les politiques. Et donc, partir d'une expérience comme celle-là, c'est super important parce qu'elle s'ancre dans une expertise de longue date. Et pour cela, moi, je renvoie aussi à ce que dit ONU Femmes sur son site. Elle rappelle que les associations de femmes ont permis des avancées à l'échelle nationale et mondiale pour les femmes et les filles parce qu'ils comprennent le mieux les difficultés auxquelles elles sont confrontées et possèdent les savoirs nécessaires pour faire progresser leurs droits. Donc cette reconnaissance maintenant, elle est institutionnelle, elle est mondiale, elle est institutionnelle et c'est important de continuer à la faire vivre comme vous la faites à travers cette plateforme, c'est-à-dire c'est votre connaissance, c'est votre expertise, c'est votre savoir que vous allez diffuser en termes de connaissance du public, mais aussi en termes de lecture des violences et en termes aussi de ce qui se fait un peu partout dans le monde. Ce que je dirais aussi, et ça renvoie aussi à l'expérience qu'on a eue, il suffit pas de soutenir de manière ponctuelle cette initiative. Il faut vraiment l'inscrire dans des dispositifs plus larges, la pérenniser à travers des dispositifs politiques et institutionnels, mais aussi en termes de financement, parce que ça va permettre aussi après d'apporter un savoir pour réorienter les politiques publiques. Et donc, c'est important aussi de la voir comme ça et pas juste comme, les politiques publiques vont soutenir cette initiative et puis c'est tout. Ça doit être vraiment, moi je suis convaincue aussi des articulations entre la société civile, les organismes publics et les politiques, les décideurs pour faire avancer, pour orienter les politiques et pour vraiment avoir des politiques égalitaires et respectueuses des besoins des femmes. Donc ça, c'est la pérennisation, c'est super important à travers non seulement le financement, mais aussi l'articulation avec les politiques publiques. Je dirais aussi que pour moi, c'est une manière, ce que vous faites, une manière de rencontrer les obligations des États par rapport aux différentes conventions qu'elles ont signées. Je pense notamment à la Convention d'Istanbul, mais aussi à la Convention CIDO, qui est super importante, qui vient de faire des recommandations. D'ailleurs, la Belgique, on sait quelque chose, on nous renvoie souvent un peu des obligations, des recommandations par rapport à ça. Et ces instruments, et d'ailleurs plus récemment, je peux aussi citer la directive européenne visant à lutter contre la violence à l'égard des femmes et la violence domestique, qui devient aussi un instrument de référence et qui doit absolument être implanté. Et puis, je dirais aussi en termes de cocorico, n'oublions pas qu'elle a été adoptée sous la présidence belge du Conseil de l'Union européenne. Mais donc ça, je ferme la parenthèse. Mais donc, ce que je voulais dire, c'est que ces instruments, en matière de droits des femmes, constituent des véritables leviers pour les gouvernements, mais aussi pour la société civile. Je terminerai par un dernier élément, aussi de dire toute l'importance des réseaux transfrontaliers. Cette plateforme va permettre des partages de pratiques et de savoirs, et ça, c'est super important. Et je me dis, ces réseaux transfrontaliers sont importants au niveau de la société civile, mais au niveau des politiques, on doit aussi trouver des manières aussi de pouvoir avoir une cohésion au niveau des politiques, au niveau de l'Europe au minimum, au niveau plus large sur les politiques qu'on veut mener par rapport au MGF. Et en tout cas, moi, je suis convaincue du travail que vous faites depuis de longues années en contact avec le GAMS en Belgique. Et donc, je vous souhaite beaucoup de succès pour la suite.
Merci.
Voilà.
Merci. Oui, ce sera toujours plus compliqué, malheureusement, de trouver des compromis. Ça, c'est aussi une autre question sur laquelle on devrait peut-être avoir des conversations plus longues, mais c'est déjà super important, je pense, pour nous tous, d'entendre justement la manière dont tu as mis la connexion qu'il devrait y avoir avec la société civile. Et voilà, du coup, je me base sur ça pour passer à la dernière question pour Vincent, et j'espère que, I hope that everybody will be okay to stay maybe 5 more minutes for the Q&A session while I ask a very last question to Vincent. Vincent, I wanted to ask you, since we heard from Hafida about the importance of this connection to civil society, also in reframing policy priorities and how to do things in a way that is more effective when it comes to especially working at the affected communities level. What do you think it is important to take into consideration when we address at policy and advocacy level the policymakers? Is there anything more that we can do, or that the EU and the UN can do to follow up on the recommendations of civil society? We know that we all face a lot of challenges, so I was wondering if you have any takeaways, let's say, for us to on what we could do differently to achieve better and more systematic support from institutions and administrations. Thank you.
I will try really in 1.5 minutes. I've worked in 3 continents. I know I don't know anything, but it's been a lot of years. What we know as an agency and what I could see myself is that because of its nature, multidimensional, interdisciplinary, with a lot of sensitivity, cultural, political implications, the way to tackle must be comprehensive, which may sound bureaucratic and all, but it's not. It's that you need the appropriate calibration in terms of law, legislation, and behind those are activists. This is feminist movement who find a space, as it happened in Belgium, but also in Portugal, in Spain, in UK, in France, and Germany, to have better laws. But that's not enough. You need smart, I would say, implementation policy, and then administrative practices, and then innovation a bit. We need community approach. It was mentioned in the introduction slides, the community mobilization, participation, and approach to on the march, adjust always the way you do advocacy, the way you influence. So you do the mapping of powers, and you don't talk the same way to the EU, to your donors, than to medical practitioners. They have different languages, different approaches. You have to integrate that into child protection system, because if not, if it's too criminalized, it's not okay. If it's too naive, it's not okay. We have to talk to diaspora. We have to talk to religious leaders, and to dare to do it, and to do it frankly. To have them as allies, but also to have this dialogue, improve the evidence, the database, the method, unify the method of prevalence, the way Belgium works, how is it working in Spain. That's extremely important to break the taboos I mentioned earlier on. So Hafida mentioned the cooperation between different services, not really interministerial, really not easy, but that's the only way to have an influence. Awareness raising among communities, among practitioners. The training is absolutely key. And then I came with a few examples of what we do in UNHCR in Spain. We have a partnership on early marriage with Plan International that brought to my attention a letter from the German Federal Ministry of Family Affairs. It's called Integra. So I will just put in the chat, and then we'll make sure all the participants can receive those links and those good practices. You have others in UK, other in Italy, and leave it there. Nessuno escluso, nobody's excluded in Italy also has. So a lot of things are scattered here and there, and our collective job is to really make sure those good practices can be transferred. They are not all transferable, but we learn from mistakes and we move on, and that's what works in simple terms. Thank you. I failed my 1.5 minutes, sorry.
It's okay. Thank you so much for saying so many things in so little time. I mean, for sure, you again touched on very, very relevant points. And I think the main challenge that we face, however, is sometimes the lack of systemic, indeed, approaches, let's say, at the administration or governmental level, which also then translates into a lack of resources, which is why we are also here promoting, but also looking for endorsements of these kinds of projects, as Christina was also saying at the beginning, because they need to be really sustained in a long term and not, just ad hoc, as also Hafida, you said. So thank you so much for both showing the support, and we hope that others will follow up on this. So I think I will leave now the floor to Q&As. I don't know, Caral, or who's the colleague who is in charge of collecting questions, if there are any.
Hi. Yes, so please drop a text in the chat. Use the Q&A box to ask any of your questions. We'll give you a few minutes, or you can also directly raise your hand if you prefer to speak directly. Thank you so much.
Yes. Thank you, Najma. Sorry, I thought there was already maybe some questions in there. I think Fabienne actually has written one. I'm just seeing it now in the Q&A. Thank you, Fabienne. Sorry, I didn't realize. So the question is, how can we explain so many differences in Europe in terms of international protection for FGM? It is really a problem in the case of the Dublin procedure. So I think, Vincent, this is mainly addressed to you, but of course, you can both answer.
Okay, so this question is valid for a lot of refugee claims. An absolute disconnection with the dynamics, the persecution trends, the way people are suffering threats to liberty, security, physical integrity, to liberty, to life, including gender-based persecution is even more remote from many practitioners. So within the 27 EU countries and beyond, you have an extreme diversity in recognition rate from the same phenomenon. For instance, Ivory Coast women in Europe, I will not name the countries, but yeah, it varies between 1% to 22%, you know, between Greece and France, for instance. So it varies because of what we said at the beginning, lack of knowledge, lack of understanding, but you collaborated with that, not understanding the issues at stake truly. But yeah, in a nutshell, because I know we have to do shortly, there is also a problem of internal training. For instance, the French OFPRA system, they have specific training on age, gender diversity, and gender-based violence trends to train permanently. High rotation, also high turnovers in Europe of asylum practitioners who may be totally ignorant. Problems of interviewing skills, understanding what trauma means in terms of amnesia, capacity to restitute a basic story. So a lot of credibility assessment, even with practitioners in good faith, but who just do not understand that the threshold is different. It's not criminal law, it's human rights law. So benefit of the doubt should apply also. Sometimes you have fraud also related to forced marriage and FGM, but a totally normal average as in any interaction with public institution. But sometimes it's a pretext to deny cases that should be granted. So those are some of the issues at stake that explain this variety in the decision recognition rate. It's still very unknown, despite having 600,000 citizens in Europe and almost 200,000 at risk currently, and dynamics with diaspora that are monitored and understood, but not so many at asylum systems level. Thank you. Hope it helps.
Thank you. And yes, indeed, this is one of the challenges that we want to also be prepared for in terms of FGM also being instrumentalized against in the more anti-migrant or anti-asylum agenda and anti-rights in general agenda, which is definitely a challenge that keeps getting bigger. So I think it's worth for us to all get as many opportunities as we can to, you know, pick each other's brain and be collectively engaged in having ready to use strategies to tackle this. I see that there is another question from Christian Ukber from the African Women Organization in Austria. It's one of the network's members as well. So it's again to you, Vincent. And
okay. We have a problem of data in terms of quantity and quality, so I cannot respond to this.
Yeah.
What I know is that there is more attention probably to early marriage in terms of response and a concern of rise among, for instance, Roma communities in the east of Europe, but also in some diasporas from West and Central Africa, for instance, because of 11 countries, 7 of 11 countries in the world with the highest forced marriage prevalence are from this region. So of course, the diasporas in Spain, Portugal, Italy, France are important, and they are still. This is they are there, and we have a partnership with Plan International. I invite you to read also their analysis, their briefing papers on that, including in Europe, to then contrast with the FGM networks, including this one, data and prevalence to continue explore. But to me, they are anyway both important and growing, possibly, not only the country of origin. We don't see much progress. We see locally in some countries, thanks to local activists that we should not abandon, but also, yeah, I will leave it there, sorry.
Yeah, thank you. And thank you so much. I know that we are out of time, so I will go to the conclusions. Thank you to both of you. I have taken many notes, and I think there's many takeaways that we can note from this discussion. So I mean, for sure, there will be also a follow-up that all of the participants will have, so we will try to also summarize those. But I really want to highlight that we appreciate a lot the support and, you know, the being on the same page, let's say, when it comes to being aware of the challenges that we're facing and also to understanding what works better in terms of approach. So what is important for us, we have tried, of course, to include all of these lessons learned during, you know, the many years that our members have been working on the ground, and then network itself, we just turned 10 years old. So we included all of these knowledge and awareness in the E-Campus platform. So I really encourage all of you to have a look at the platform, to make sure that you subscribe and that you also spread the word and engage with you know, everybody who might be interested or adopt this type of tools in their daily practice, because you might know that, for example, these professionals or practitioners or of any kind are likely to come in touch with FGM affected communities, and therefore we hope that this will serve them to do a better job. Yeah, so please support us. Let us know if you have further questions. We are always available. Do not hesitate to reach out to the Secretariat or our members and Mix, that is the coordinator of the project. I wanted to also ask you to scan the QR code that is provided to sign up as endorsers and also to access the resources. I don't know, it was in the PowerPoint, but it will be shared also in the follow-up email, so don't worry. And then, yeah, thank you again, everybody, for your participation. I'm really happy to have had the chance to facilitate this. I will just give now the floor for a final thank you to our host Anita from GAMS. Thank you so much, and of course co-president of the network. Thank you.
So thank you, Jenny. Thank you, Vincent and Hafida, for the presentation. So I'm going to do a quick summary of the key points covered. Yeah. Sorry. So today's event marked the launch of the E-Campus platform, a significant milestone in the fight against FGM. So the platform, developed by the Mediterranean Institute of Gender Studies, MIX, in partnership with IDOS Italy, APF Portugal, CUT Cyprus, GAMS Belgium, and also the End FGM European Network, is designed to fill critical knowledge gaps for professionals working to address FGM across Europe. So the main insights included an introduction to the E-Campus platform, so with the purpose, which is to educate and empower European professionals by providing resources, raising awareness, and eliminating taboos around FGM, and also the importance of bridging the gap between knowledge and practice to support survivors and affected communities. Also, we had like a great, insightful fireside chat in which Hafida Bachir shared Belgium's successful policies against gender-based violence and FGM, including examples of specialized centers and inter-agency collaboration. So she emphasized using best practices to inspire and guide action across Europe. And we also had the presentation and intervention of Vincent Briard, who highlighted challenges encountered in addressing FGM, especially in asylum context. And he discussed the value of the E-Campus platform in debunking myths, raising awareness and fostering collaboration to implement effective strategies. And also, as policy recommendation, we identified the need for systematic and long-term support for initiatives like E-Campus, the role of civil society and practitioners in shaping the policies. Also, a call for European cohesion and cross-national collaboration to amplify the impact of such efforts. And finally, the platforms like E-Campus are essential for driving positive change by equipping professionals with the tools they need to support the survivors, prevent FGM, and also advocate for systematic improvements. So on behalf of the End FGM European Network and its partners, we would like to thank you all for taking part in this lunch. A special thanks to Vincent Briard and Hafida Bachir. Your insights have illustrated the urgency of the situation and the pressing need for Europe to take concrete actions to end FGM and also to support those affected. So one key takeaway is that professionals who engage with FGM survivors and affected community have the potential to become change makers. And with the right tools, like those offered by the E-Campus platform, for example, we can create sustainable change and transform lives. So we encourage you, as Jenny said, to endorse the platform. So join us in our collaborative effort. So you can scan the QR code provided to sign up as endorsers, access resources, and support this initiative. And also, and most importantly, I will say, is to spread the word. So share the platform widely, use it, ensure it reaches everyone who can benefit from its tool and knowledge. So once again, thank you for your active participation. And together we can create a future free from FGM. And I wish you a wonderful evening. And we look forward to seeing you again soon. So thank you, everyone.
Au revoir.
Au revoir.
Thank you, everyone.
Thank you. Au revoir.
Thank you, everyone. Have a good afternoon.